So the role of the GPO in the cancer patient journey would be involved from usually at the time of diagnosis till completion of treatment, particularly the chemotherapy treatment, which is offered at the hospital. And although the family physicians are very involved with, and continue to be very involved with the cancer care of patients throughout their journey, we are lucky to have 4 of us who have more specialized training now, so that we can provide slightly more specialized cancer programs for the patients in conjunction with the excellent collaborative staff here at the hospital, which includes the nurses, the chemotherapy nurses, the pharmacists, the navigator, the x-ray technologists, and the specialists that we work with down south. It's nice to be able to provide a standard of care that would be equivalent to the services outside. And we look at it as really important to have that connection of family and the support of family and friends and community at this time. It's so critical for the patients going through the whole gamut of cancer care.
So the role of the RN in the patient's cancer journey is that we coordinate, manage, and deliver chemotherapy here in Karen's room to provide quality care for our Yukoners. Cancer treatments can be complex and stressful, so our goal is to create a compassionate room for our patients and their families during treatment. Dedicated nursing care during treatment means that Yukoners will have access to caregivers with a special and unique understanding of cancer treatment.
The pharmacist assists in the patient's cancer journey by assessing the patient's protocol and ensuring that the physician's orders are correct, and then we proceed to prepare the chemotherapy for that patient. It ensures that the patient gets the correct drug, the correct dose, at the correct time. As a dedicated chemotherapy pharmacist, I meet with the patients, I sit down with them, I ensure that any of the medication that they are taking, aside from their chemotherapy, does not interact with their chemotherapy. I act as a resource for the patients and the nursing staff, as well as the physicians, for any of the medication questions.
When a patient receives a diagnosis, it's often a very overwhelming and confusing time. As the navigator, I can help guide that patient and their family through their cancer journey. My goal, alongside of the hospital and the government, is to connect and network with all healthcare professionals involved in cancer care to help ensure a continuity of support. The ultimate goal is to have various supports throughout the cancer journey so that the patient always has someone to turn to when they have questions or concerns about their treatment and care. I work closely with your oncologist, physician, pharmacist, and nurse to help ensure that you receive the best care possible.